our group will be presented about positives non-iodinated based contrast media. As we know, contrast media is always been needed to make sure radiographs are presented are more clearly seen. For example lah, contrast media was always being used to CT scan to show some of certain radiographic indication that the kita my part, I will explain about type of contrast media. Okay, the contrast media that will be chosen is positive non-iodinated based contrast media. Okay, what is non-iodinated based contrast media? It's made for barium. Barium is the something that have high atomic number. So this contrast media have been used barium sulfate or BaSO4. This type of contrast media is cannot be absorbed by body, so it can be used intraocularly or inhaled. So we can use this can inject it sebab it can absorb into the body. Okay.
Hi, my name is Sita Christina Binti Ibrahim and my matrix number is 075660, and my part is to explain about the preparation on how to use contrast medium. So, as for the patient preparation, firstly we need to check whether the patient is pregnant, and then ask the patient about their history of allergies. Then ask patients history of illness, as for example, diabetes mellitus or asthma. Lastly, ask patients about medication that they are currently taking. And then, before starting the procedure, we need to explain about the procedure to the patient and state a consent form from the patient. Then check patient's card such as a baseline vital sign, their allergy or hypersensitivity. Next, we need to ask about other illness of the patient. For example, hepatic or renal disease or pregnancy. And we need to always be ready for the possibility of adverse reaction. So we need to prepare for emergency card. Then, for some procedure, we need to ask the patient to fast before starting the procedure. And then besides that, we also need to ask patients to take medicine as provided. And lastly, we must advise patients to drink plenty of water to stay hydrated. And then, during the procedure, firstly, we need to monitor the patient and ensure patient's comfort. Next, we should confirm and inform the patient that they might feel warm or have a sense of metallic taste on injection. Lastly, after the procedure of contrast media, we need to apply pressure on the injection site to stop bleeding. And then we must ensure vital function of the patient such as respiration, blood pressure, presence of sinuses. Sinuses is the medical term used when skin, lips, and nails turn blue due to lack of oxygen in blood. And then we need to observe the patient for at least 20 to 30 minutes after the injection of contrast media, and then advise the patient to drink plenty of water. As for pre-medications, patients with known allergies must take prednisolone 40 milligram 12 hours and 40 milligram 2 hours before the procedure. Next, multiple myeloma patient must be well hydrated. And for your information, myeloma is a type of blood cancer. And as for diabetic patients, they need to stop metformin 48 hours prior to examination. So that's all from me, and I will pass to Fatin.
This is the application that used for contrast media. It has more, but I list down only 5. So the first one is a computed tomography or CT scan, and then angiography, next fluoroscopy, venography, and X-ray. So the first one is computed tomography or CT scan. It used to enhance the visualization of blood vessels, organ, and tissue such as tumor, vascular lesion, and infection. So next is angiography. Angiography is a iodinated contrast agent or injected directly. For angiography, iodinated contrast agent are injected directly into blood vessels to visualize arteries and veins. Next, fluoroscopy. Fluoroscopy is a real-time imaging technique used during procedures such as barium swallow studies, cardiac cauterization, and joint injection. And then we have venography. Venography used to visualize vein, especially in the lower extremities. It is also ejected into vein, and then detecting abnormalities like deep vein thrombosis or DVT. Last one is X-ray, which is less commonly used. Highlight specific area of interest such as the gastrointestinal tract and the urinary system.
And to conclude, the usage of contrast media in radiology is so useful to improve visualization of structures. Contrast media enhance the visibility of internal structures such as blood vessels, organs, and tissue, which helps radiology to identify and characterize abnormality more accurately. And besides that, contrast agent also help in enhancing detail in image. Contrast agent help to differentiate between different types of tissues. So this is particularly useful in complex areas such as brain, heart, and gastrointestinal tract, where fine details are crucial for accurate assessment. So I think that's all from us, and thank you for watching.